Good morning. This is Mark Chibahusky with MCZ Align, and this is the first episode of Align Health Insights. And I'm honored today to have a personal friend, colleague, and my first guest, Scott Howell. Scott, nice to be with you today. And just please tell the audience a few words about your background and what you do to serve our healthcare industry.
Hey, Mark, great to see you as well. And thanks for having me join you. Yeah, these days I'm kind of freelancing, as you know. I'm in a phase of my career, I consider this the third phase of my career, where I'm getting to give back some professionally and also, though, to spend some time working on projects and initiatives and with people that I find interesting and that I can learn from. But I started my career as a physician. I worked in clinical medicine for a decade, including some time a transition into health services administration. And from there, got recruited to the life sciences industry. And that became the second phase of my career, which lasted 25 years. And I worked at four different pharma and biotech companies. I worked at a big payer and ran the pharmacy program, and also at one of the large distribution and manufacturer services companies.
Wow, what a background. That's amazing. Well, we've had the opportunity to work on a couple of initiatives together over this free agency of yours. And
Right.
it's been a lot of fun learning from you. You really are a wealth of knowledge. I mean, especially when it comes to market access. I mean, you're probably one of the top five thought leaders in the country. So, what's the earliest memory you have about wanting to even get into healthcare, Scott?
Yeah. So when I was young, I was not pointed at healthcare. I grew up in a small town in eastern Ohio in Appalachia. It was coal mining and farming country. And my dad owned and operated a machine shop. We repaired coal mining equipment. I grew up working in the machine shop. And so when I went to college, I thought I was going to be an engineer. And, freshman engineering classes taught me otherwise. And so I came home with the summer break and, with some trepidation, told my parents didn't think I was cut out to be an engineer. And so they said, fine, what do you think you'd
Yeah.
like to do? I had really enjoyed my freshman English and literature classes. And so I said, I think I'd like to be an English major. And they said, no way are we paying for you to go back to college to be an English major, and go think some more. And so I went away for a few days, and, a small town like that. And in those days, we didn't really have a breadth of, I'll say, professional role models. There were
Yeah.
bankers and some lawyers and doctors and shopkeepers and that kind of thing. I was good in math and science. And so I came back a few days later and I said, how about pre-med, mom and dad? And they said, you may return to school.
Wow, that is so funny. I have to say, when I was in 11th grade, I said, I want to be a doctor. And then they put a fetal pig in front of me to dissect. And I
Yeah.
said, I don't want to be a doctor anymore. It
Yeah.
was pretty clear to me that that was not my path.
Well, what I
Look,
found was
go ahead.
once you got on the pre-med, path, you really didn't have to think about it again for quite some time. It took you through pre-med, then medical school, then internship and residency, and right into practice. And it was those were foundational times for me. I learned so much, and I was imprinted, I think, with the values of the health system and how
Yeah.
how important that is. And as you know, I've carried that with me the rest of my career, and I'm really grateful for having gotten started in my career that way.
Well, the way you describe that flow just goes to show me you're a pretty smart guy. I mean, like, because that's a tough road. But also, as a segue, it provides such a good foundation of the first principles of what healthcare really is prior to all the technology,
Right.
right? So it ushers in a really nice next question: is how do you think artificial intelligence is going to change the industry? And then a following question, just look. So Travis May, right? Shaper Capital says that there are now 151 use cases for healthcare automation, right? So it's like, I think the following question is going to be like, why is trust so important here, Scott? So,
Hmm.
how is artificial intelligence going to change the industry? And then let's talk a little bit about trust.
Yeah, great. Well, so in this third phase of my career, as you know, Mark, a fair amount of the time I'm spending with a venture capital firm in San Francisco, Pear Venture Capital, and a number of their portfolio companies and some others that I've been advising. And the majority of those companies are health tech companies. It's a space
Yeah.
that I've been interested in for a while and have wanted to learn more about.
Sure. Yeah.
And the majority of the health tech companies are AI enabled. And I have to say, in particular, like the last 6 months or so have just been an eye opener for me. And I believe that the world is different now than what we thought it was going to be, 3 years ago or so, and that we've turned a corner. Humankind has turned a corner into a different future than we thought was before us, and it's going to be fantastic. So much is possible with these technologies, but it's also going to be a little scary and disruptive as well.
Yeah.
And so, anyway, I think AI. If I go back to the life sciences industry, I'll say, as an example of the applications, I think it's going to transform the industry. I think there are two main buckets of applications. One is in trying to improve uh, drug target identification and drug discovery, lead optimization, however you want to think about that, and hopefully improving the yields that come out of R&D. That's super important and is badly needed by the industry. But then the second is, a broad part of it's a subset of broad use cases going to occur in lots of industries. But that's just operational improvements. And there'll be improvements both in efficiencies, but also in service levels for customers and patients and, everyone else. And those are going to be massive as well. They're going to be big advantages, I think. It's and smarter, better, faster, cheaper, and all the above. So anyway, I
Yeah.
think the world's changed.
Yeah. Scott, great points. When we look at the regime change, we have a conservative president, more pro business, very pro AI. All right, but with that, there'll be a lot that will get done. We see a lot of money coming into the sector, but we also see that you know, things like privacy probably aren't at the forefront here. So I just think, and so with every administration change, right? There's going to be some things that are going to be good. There's some things that people are going to be concerned about. I think I only bring this up just because it
Mm-hmm.
does bring down that question of trust, algorithmic bias, et cetera. So, what's
Yeah.
your take?
Well, so you're right. Of course, trust is foundational, and we can even I would just put aside for now the changes in the government. We can come back to that if you like. But even independent of that, this is a very different, technology. It's a different future than we envisioned. It's going to be quite disruptive, and and it'll bring a lot of uncertainty with it as well as we make these transitions. And at the heart of AI is a computer algorithm basically telling you as a user, and you could think of it in this case perhaps as a patient or whatever, that
Yeah.
hey, I've surveyed the information. This is what I believe based on that, and this is what I think you should do, and I can help you do this, or I can help you with that, and so on. But all of those conclusions and therefore actions, um, at their core depend upon trust. They are the things that we have today in our human interactions. Where if I'm a doctor and you're my patient, and and I say, "Hey, Mark, I've known you a long time, and this is what I think is going on. Here's what I
Yeah.
think." At the core of it is like, do you really trust what I'm telling you? And so I think none of that goes away. And in some respects, it's even more important because it's a bit of a black box and it's a bit
Yeah.
removed from what we experience and see every day, different from our human interactions in that regard. And so I don't think the technology companies and the policymakers and so on necessarily have all this figured out yet.
Yeah.
But that's okay. I think that's kind of to be expected given where we are, again, early days. But it's going to be hugely important as we go forward that people can trust the algorithms, but also the data that they're being trained on. And then there's a whole, especially in healthcare, as you know, Mark, there's a whole host
Yeah.
of ancillary issues around privacy of my data and, all of those kinds of things as well. And so I think, for these are foundational, and for society to reap the benefits that are going to be possible in this future, trust will remain foundational.
I agree with everything you're saying. So look, um, given over the span of your career, right? You know, what are the biggest changes that you've seen in our healthcare industry? One, right? And two, what do you think needs to change?
Mm-hmm. Well, if I think broadly in healthcare, I think the biggest change now compared to when I started practicing medicine has been the, I'll say, corporatization of healthcare. Um, the when I when I started, like, going into private practice was sort of the natural path, and it's what
Right.
my wife and I did after we finished, our residencies. And but today that's not the case at all. Today, the young doctors are looking to join and be employees of large integrated health systems or large provider group practices, or private equity firms that are doing roll ups, and or
Yeah.
just go to work right inside a company as a medical director or something like that. And and, and there are good, and so the practice so the practice of medicine has gone from this highly fragmented cottage industry where it was you and me with a relationship
Yeah.
in the office, in the exam room, to now where it's like, I'm a patient and my insurer is some mega, company that with a for-profit entity, and it's not only an insurance company, but it's also a PBM and a pharmacy, and oh, by the way, a large employer of doctors and home health agencies and all this other stuff. And I'm kind of fending for myself in many respects, and I'm trying to guess kind of
Yeah.
who's really on my side and has their incentives aligned with me and who doesn't. And so anyway, all of that has created huge shockwaves in the organization and delivery of care in the U.S. And so that's my answer, kind of writ large, for healthcare.
Yeah.
In the life sciences industry, what I would say, and I just came back from some time in California helping to lead a class at Berkeley in the MBA program where I've been teaching for many years, as you know.
Yeah.
And we were looking at the key trends, top trends in biotech and pharma these days. And the premise of the course was it's a paradoxical time in the industry that, on the one hand, the science has never been better, which is
Yeah.
absolutely true. It's absolutely amazing what's going on with science. And the business has never been harder. And that's and which is also true. And it's
Yeah.
being driven by declining global reimbursement for drugs, and now non-zero interest rates. And
Hmm.
the third one I would add here in the last few weeks gets back to your point about the change in the administration. But I would say all of the uncertainties and the changes in the relationships relative to the government
Yeah.
as well.
For sure.
So
So I
anyway,
mean,
a paradoxical time. Lots,
the
lots
par-
up in the air.
so that leads to the second question, though. It's like, look, healthcare is very policy driven. It's very relationship driven. It's a highly complex system. Uh, so I mean, you could characterize this in like the big changes that need to occur. Maybe it would be the macro, and then to the micro. Like, how would you start incrementally changing things, and where would you start?
Mhm. Well, I'm
I
going to
mean,
stick.
it's a tough question.
I'm going to stick to life sciences here,
Fair. Let's
as
just stick. Let's stay
as
there. Fine.
because right now I don't think there is an answer to healthcare writ
I
large.
mean,
We,
it's a
you
it's a
know,
tough it's a tough
yeah.
question. However you want to answer it, we'll focus on the life sciences.
But yeah, for life sciences, what I think is we've had a model for funding innovation globally for the last 30 or 40 years that has worked pretty well, and it has been built on this period of hey, we start to work on something in R&D. It takes a long time and a lot of money, and most of them fail. But eventually, the ones that hit the market, we get a patent on. And so we have a period of time where we can be the sole producer of the medicine and we can have some degree of pricing power. But then competition will come along, the years will pass, the medicine will lose the intellectual property rights, the patent, the medicine will become genericized. And then um, and basically the benefits are turned back to society at that point. The
Yeah.
medicine becomes very inexpensive and it's available forever and ever. You know, five Lipitor at $5 a month forever and ever is like a
Uh-huh.
fantastic deal. Exactly. And that has worked well for like 30 or 40 years globally. And but now it's coming apart. The industry has, you know, not on purpose, but the effect's the same. We've been painted into, or painted ourselves into, a corner. All of the large primary care markets, um, hypertension, diabetes, cholesterol, and so on, that were leading the way when I started in the industry years ago, and had just, you know, tens of millions of patients, so large numbers of patients, very
Yep.
small per patient prices. Those are all genericized now, and so the industry can no longer really mostly compete in those
Yep.
areas, and so it doesn't drive um, revenue from them. And so now the prescribed market in the U.S. is less than 8% of all prescriptions. 92
Yeah.
plus percent of the time when we fill a prescription in the U.S., it's a generic medicine. And so we're hyper concentrated on, you know, very small um, groups of patients. And as you
Yep.
know, they've migrated. We've migrated into the specialty oncology, rare
Yep.
disease, you know,
For sure.
areas. And these were the areas that were left. These were the areas where there was still unmet need, and some patients where, you know, you could make a difference and you could have a product and build a business.
Yep.
And so we flipped now to this like low targeted groups of patients, low numbers, and very high
Mhm.
prices. And so it's an upside down pyramid. And every year, as more goes generic, we go from 8% of scripts to 7 to 6 to 5.
Yeah.
And so, by definition, the business model itself structurally is kind of unstable. And then you
Hmm.
add to that, um, uh, I used to say, declining willingness to pay outside the U.S., declining
Yeah.
reimbursement outside the U.S. But now I would say, you know, within the U.S. as well, you could point to Medicaid and Medicaid expansion. You
Yep.
could point to 340B and the expansion of 340B. You could point now to the IRA and Medicare
Yep. Sure.
price increase penalties and negotiations and so on. But you know, the percentage of the market where you still had some pricing power and could make, you know, a better profit margin has shrunk, and it just continues to shrink. And so the combination is, you know, actually just created, and then you throw in non-zero interest rates.
Oh yeah.
Uh, you know, it's a difficult time. And so anyway, the prescription for this for the industry has got to be that the next 30 or 40 years have got to be fundamentally different, and they've got to be
Yep.
built on a model that is radically more efficient. It's got
Yep.
to, and you know, right now the best bet for that is where we started earlier with the AI, both improving yields from R&D, because a lot of the money, as you know, is tied up in the failures,
Yep.
but then also radical improvement in the operational efficiencies that occur after the, you know, drug discovery
Yep.
as well.
Yep. Yeah.
And you know, so kind of fingers crossed that that works, but uh, and that it's enough. And but you know, only time will tell. But certainly, the next the model that's powered the last 30 or 40 years is not going to be the same for the
Right.
next 30.
Yeah, just to add CMS rule max fair pricing, to add, you know, the 10-year treasury yield curve and the biotechnology index are completely inverted. So
Yeah.
there's a long-term funding problem there. I mean, so, you know, ultimately, I mean, reductively, like, what is your like outlook for the life sciences industry over the next, I don't know, decade?
Well, it's choppy times right now, as you know, in the industry.
Yeah.
The most of the big established companies, you know, have been having and continue to face genericization events, which creates, you know, divots in the revenues. which they try to fill in between their own pipeline and then other late stage assets that they can go acquire.
Yeah.
And so most of them are out looking for late stage assets. They're expensive and there aren't enough of them to go around. And so the companies then have been forced to confront restructuring and layoffs as well. And so, we've had pretty broad based layoffs for, probably at least 3 years, recurring layoffs across the big companies in the industry. We've had a number, we've also, we've hit the venture market, IPO market has gotten gummed up a little bit. The IPOs have definitely more recently, slowed down, not been as successful. And so that's not as available to as many companies as before. What that means for the venture funds is that they have to reserve part of their funds for later rounds of
Yep.
repeat funding for the portfolio companies that they picked to begin with, which in the
Yep.
past they wouldn't have had to do. They could have tapped, the equity markets for that. And so then that means there's less uh, venture funding available to go into the early stage stuff because they're
Yep.
reserving it for the late stage stuff. And so anyway, the whole thing is kind of, slowed down and plugged up and and suffering a little bit right now, I would
Yep.
say, Mark.
Yeah, no, I agree. At the same time, all these automation use cases and their hope to, reduce headcount and save money. I mean, I hate to say it, but it's true, right? Are the promise, and we're seeing a lot of the money go there. Uh,
Yep.
Okay, so let's just have a little bit of talent discussion, right? So, when you were, I know you're a free agent now, but when you're hiring, I mean, what kind of characteristics did you look for in talent? I mean, and when you're thinking about early stage and advising some of these companies, what kind of characteristics are you looking for people to join and really create, the best types of teams that
Yeah.
are going to have the highest chance at upside?
Yeah. I think at the base level, like the first question I always asked was, and this is almost a screening question, really, is like, does the candidate have the requisite knowledge and experience,
Yeah,
yeah, to believe that they can function well in this area? And then next, I would ask myself, what, about the candidate's traits and characteristics do I know
yeah,
or believe to be true? So, and I would I'd look for people that have a degree of ambition, positive ambition. They want to aim high, be the best they can be, want be part of the best team, that they can. People that are accountable, folks that can be self-directing, lot, you know, all the sorts
yeah,
of things that you would think of in great talent. And then at the third level, it's really about leadership, or for candidates who are earlier in their careers, their potential as leaders.
yeah,
And when I think of leadership now, and I've spent a lot of time thinking about this stuff, over the
yeah.
course of a long career, but as I've reflected on it and done a little teaching on it as well, um, there are two primary things that stand out to me, Mark. One is leadership at its core is really about trying to get the best out of other people. How do you
Hmm.
do that? How do I get the best out of a group of other, either individuals or a group of other people? And so, there are a whole host of different ways to enable that, to do that. And so for an individual leader, how well do they understand that? How well they align with that view of leadership? How well do they understand that, and what they bring to the party, I'll say, in terms of trying to do that. And mostly that's ends up being like understanding, like, what's your recipe for success as a leader? Like, when
Yeah,
I'm functioning well at the front of a team, here's what that looks like. And here's the kind of role I play, and here's what the other team members are like, and how they play and all that. So
yeah.
that's number one. How do you get the best out of other people? But then number two, I think the next thing is the recognition that so much leadership is actually situational. And do you have the self-awareness, the situational awareness and self-awareness, to understand that, to recognize that, and then to flex and adapt around what is your core recipe for leadership? So sometimes you'll step into a role, as where the team, you know needs a leader to, like, set a new bar, to aim, raise the ambition, raise the pace, be a bit of a driver, those kinds of things. Other times you'll step into a role where that's the opposite of what's needed right now.
Yeah, for sure.
It's there's too much going on. It's people are overwhelmed, and what they need is for somebody to sort of take the air out of it for a little bit, catch the breath, everyone catch their breath, let the dust settle, pick our heads up, do a little thinking and a little planning, and decide then in a more measured pace, like what's next. And so, anyway, do you understand that leadership is about other people first? And
Yeah,
do you have a way to tap into that yourself and enable that? And then, secondly, can you be situationally and personally aware and show some
yeah,
range around that?
yeah. I think that for me, it really comes down to a sense of humility, right? It really
Sure.
seems to be highly correlated to situational awareness, right? So when you were actively hiring, or when you're looking at some of the teams you're currently advising, what do you think some of the troubles that they're having finding the right talent?
Well, I would say, right now there's a lot of talent available in the industry for the reasons that we talked about.
Yeah,
There are, I think the biggest thing is a little bit like this situational awareness. Things have changed, and for the industry fundamentally, um, and for the future as it relates to technology and AI. And but you know, there are a lot of folks that aren't acknowledging that. Like even company CEOs, largely aren't talking about many of these challenges that we've discussed, and um, and so if you're thinking about putting together an A-plus team for the future now, and certainly at a small enterprise where you're trying to create new solutions, new approaches for this stuff, you need to be filled with people who have those insights and have that awareness and are willing to speak truth to it. They're not.
yeah,
Yeah, it's oftentimes easier, as to kind of say, even if you understand it, just to stay quiet about it. Like there's no real advantage for most company CEOs to be out there talking about what a hard time it is for the industry and for our company these days.
yeah. No, that's
um
a really good
yeah,
point.
but
Wow.
but you need people on your team that get that and
Yeah,
and are willing to do the work that's required then to adapt to it.
yeah, it makes a lot of sense. Okay, look, we're gonna have some fun, just getting some rapid fire questions, getting my audience to know you a little bit better. I just think these are questions that I want want to know. So, do you like music, Scott?
Yeah, sure. About as much as, the average person, I'll say.
So, do you have a favorite song?
Yes. Band on the Run. Paul
Oh,
McCartney and
nice.
Wings. Yeah.
So, is that like "Band on the Run"?
Yeah.
That one? Yeah, I like that. That's good.
Exactly.
That song makes me happy. All right, so
Eh,
uh, go ahead. Sorry, what were you saying?
no,
Oh,
no, go ahead.
okay. So, first thing you do in the morning, it could be a productive thing, it could be a non-productive thing. I'm just wondering, like, how do you get your day going?
I get up and I make coffee and breakfast, and then I read the Wall Street Journal.
Very good, very good. Yeah, coffee is
And
a
I've been
huge
doing
part.
that since I started years in practice years ago. It's a habit I picked up from my dad.
Very cool, very good. Okay, so um, this is going to be a hard question, and you don't have to pick one. You could pick three, or you could just answer it however you want to answer it. But what leader do you most admire in the healthcare and life sciences industry?
Yeah, so for healthcare broadly, I'm going to point to one of my early physician um, professor, attendings and mentors, Earl Metz, amazing oncologist who was on the faculty at Ohio State, where I was a medical student, and embodied everything that you would want in the traditional healthcare, practitioner's value system. If I can channel more of that every day, that's a good thing. And then in the industry, I'm going to point to Art Levinson, who was CEO of Genentech when I was there. Art's like one of the most amazing people I've ever met. He's, I think, perhaps the smartest person I've ever met, and perhaps the most humble as well at the same time, which was amazing to see. But while he was an early founder at Genentech and chairman and CEO at the same time, he was also on the board at Google and chairman at Apple,
Wow, wild.
just to give you an idea of that guy's range. And
Yeah.
Uh, and he had a super clear, simple recipe, for himself and for leading the company at Genentech. And the first was always follow the science wherever it takes you, even if it's not in your product's best interest. The second was always make decisions that are in the best interest of patients, no matter what, even if it's not in the best interest of your business. And then third, make it a great place to work, because we want the best people and we want them loving it here and working super, super hard, because we're on a mission to
Wow.
cure cancer.
Those are really great, values and principles for any organization. So look, Scott, I'm super thankful that you were my first podcast guest and my first LinkedIn Live guest. Really grateful for our friendship and our working relationship. To my audience, this has been the first episode of Align Health Insights from MCZ Align. Thank you very much. Ciao.
Thank you, Mark, and congratulations.
Thank you.